Chronic diseases develop over one's lifetime, with clinical sequelae occurring many years after the underlying pathogenesis of the disease has occurred. As we move ahead in the 21st century, cardiovascular diseases such as coronary heart disease, hypertension, stroke and heart failure, also type 2 diabetes, metabolic syndrome and cancers are the leading killers in westernized society and are increasing dramatically in developing nations such as Nigeria. In fact, obesity, diabetes, and hypertension are not even commonplace in children. Clearly, however, there is a solution to this epidemic of metabolic disease that is inundating today's societies worldwide. Exercise and diet. Diet and exercise play a key role in influencing chronic disease progression. Studies have also shown that people who maintain an active lifestyle can reduce their risk for chronic disease by up to 50%. Exercise can help people with long-lasting conditions cope with symptoms and improve their overall health. Long-lasting conditions can include heart disease, diabetes, depression, or back or joint pain. Today on your favorite Health TV talk show, The Physicians, we will be talking about importance of diet and exercise in the management of chronic diseases. Do stay tuned. It's another day on your favorite Health TV talk show, The Physicians, where your health is our business. Today on the show, we'll be talking about the importance of diet and exercise in the management of chronic diseases. My name is Dr. Memuna Yusuf Gadri, your regular anchor on this show. And of course, you know I don't do this alone. I'm always with my Siamese twins, and she's no other person than the lovely.
My name is Dr. Martina Agberi. Welcome to your favorite TV health talk show, The Physicians, where your health is our business and will remain our business.
I said today's topic is your food.
You know,
I don't know why I'm even here. Let me just go. Let me sit down somewhere.
I pay particular interest to
and listen to you.
Yes, I pay particular interest to anything that has to
importance
do
of
with
diet
lifestyle.
and exercise in the management of chronic
I
diseases.
will always say it. I will always say it, that if we put the benefits of exercising as a pill, it will be the best sold pill in the world.
You see, that is it. There's no way. If anytime I hear that, I just remember Martina. There is no other way.
That's it.
Anyway, this is very key, and I particularly like this topic because we are relating it to the management of chronic diseases, and we are seeing that infectious diseases. Yes, we are low and middle income countries.
Yeah.
We are more aware these days.
Yeah.
You buy oranges by the roadside, people will still look, they will look for water to wash. Carrot, they will look. So infectious diseases, though they are still killing us, but not as much as the non-communicable diseases, the hypertension, the diabetes,
I think it's because we're trying to get westernized.
Copy and paste.
Without editing.
Without editing.
So that is exactly what has happened. We do a lot of these things that they do, and we don't even exercise. So we don't even cook anymore. Most of the youth.
Yeah, they'll tell you if you are exercising. Especially if you are slim. Why are you exercising? Did you kill somebody?
Forgetting that it has nothing to do with not really with the size.
At all. We know that exercising is so powerful. Yeah. We use it in managing most medical conditions.
But you know, they said if you exercise regularly, right? Yeah. At least 50% of the side effects of the challenges that you have will reduce. For instance, high blood pressure.
How do we preach this enough?
We'll keep saying, we'll keep talking. That's all we'll do. We'll keep advocating. That's why
this is a program where.
And you know why I love here? Because the physicians will always try as much as possible to debunk what they post on social media.
Yeah, you're right.
Yeah.
Especially social media, TikTok, because that is where studies have shown that 33% of the Gen Zers and millennials get their health talks from.
Which is very dangerous.
It's sad. That is 1/3, 33%. Anyway, we have an expert coming on board, and he will be schooling us. For those that you think you already know, let this serve as a refresher course. For those that don't know, this is the right time now to call your neighbors, gather people around. The physician is about to hit the screen. We'll be right back after this time out. Don't stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplements for you and me. In your body, that I fight you.
Dietary nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Dietary from LB Pharma. Dietary, love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today on the show, we are talking about the importance of diet and exercise in the management of chronic diseases. With us in the studio is an amazing, lovely doctor who is very good in what he does. He's no other person than Dr. ADEKUNLE DOSUNMU, the MD of Southern Gem Hospital. Southern Gem, I love the name, by the way.
Thank you very much.
Precious patients, precious clients.
Yeah.
Dr. DOSUNMU, you're welcome on board.
It's a pleasure. Thank you very much. Thank you for having me.
So we're talking about the importance of diet and exercise in the management of chronic diseases. Let's talk about chronic diseases because it's good for us to start from that end before we talk about the importance of diet and exercise in the management. So what are chronic diseases?
So basically, I tell people that chronic diseases are conditions that you will not probably be able to cure, and you have to manage it over a long period of time. And mainly in our environment, those are conditions that tend to be genetic, tend to be passed within the family, or they have to do with our lifestyle. And the major burdens we have right now in Nigeria are more of cardiovascular diseases and metabolic diseases. So the commonest chronic conditions we encounter in Nigeria right now will be things like hypertension, diabetes, arthritis, peptic ulcer, amongst other diseases. And most of these conditions, they tend to occur within familial trees. So when we discuss with the patients, we get to know that probably someone within the family, their siblings, their parents, their grandparents also went through similar conditions. Let's not forget also that cancer also falls within these conditions. We can call it a chronic condition, although the duration of cancer sometimes tends to be quite short, unfortunately. But they tend to be associated sometimes with lifestyle. They are very much affiliated with genetics as well. And these are things we have to pay attention to. So I tell people that diet and exercise, they tend to complement each other. Although I think, personally, I feel diet is much more important than exercise when managing a condition. But exercise, it really helps psychologically, number one. When somebody exercises, they feel better, they feel optimistic, they feel they have things in control. And then number two, depending on the exercise we do, we're moving our muscles, and then especially if someone is diabetic, you're moving your muscles, the muscles need energy. The muscles is tapping into the glucose that is in your bloodstream. And then if, unfortunately, maybe the person just took something that is high in glucose, the exercise will help absorb the glucose, you burn the energy. So the tendency for you to have excess sugar in your system is reduced. Number two, exercise builds your muscles. You need those muscles to convert energy in your system. Now, if you don't have muscles, what would replace those muscles will be fat tissues.
True.
And then those are not, they don't do well in converting or burning the excess glucose. They tend to store it in them. So the importance also comes in when you get old. When you clock in the age of 50, 60, if you've not been exercising, your muscles tend to start atrophizing, and then you start losing your muscle mass. Your joints, they don't have that stability again. They become stiff and things like that. So when people exercise, we tell them that if you start exercising from a young age, you're not doing it for yourself today. You're preparing for your old age. If you look at the frame of someone who is in their 20s and that of someone who is in their 60s, you can see the difference. Naturally, the older you get, you start to lose your muscle mass. And at the point when you can actually build that muscle mass, if you start building it, you're not going to lose much muscle mass as you get older. And the question will now be, why do you need the muscle mass? You need it for mobility. You need it, as I said again, to metabolize excess sugar in your system. And also, you need it to get rid of excess fat under your skin, in the belly. When you're trying to lose weight, it's easier to lose muscle mass than to lose adipose or fat. So those are the things you need to look at.
So it's easier to lose muscle mass
than the fat.
Yeah. So I want to go back to diet. How does diet positively or negatively impact, cases when we're talking about chronic disease?
So I can start with cancer. There is a research going on about, we know that cancer cells, they have high affinity for sugar. And the newest means of diagnosing cancer has to do with sugar. They look at the concentration of sugar in the body, and when you have high concentration of sugar, they start investigating to be sure that is there cancer, is there a cancer cell there manifesting and things like that.
Seriously?
Yeah. So there are also other researchers that have been talking about starving the cancer patients of sugar and changing their diet. And here in Nigeria, we're seeing some alternative medical practices that are trying to migrate patients to fruit diet. And I tell them that, yes, that it might be good intention, but then when you migrate someone to fruit diet with the aim of starving them of sugar, and you're putting them on watermelon, pineapple.
Like pineapple, apple.
What is pineapple?
Yes.
What is apple?
So
a lot of natural sugar in them.
Yeah. So, but what I'm driving at is that cancer cells have been proven to have high affinity for sugar. They feed off sugar, and we're trying to look at ways of managing, not treating, but managing cancer patients with possibly a low carb diet as well. And it's not only cancer. If you look at conditions like hypertension and diabetes as well, it is absolutely necessary and important for people with cardiovascular conditions to manage their intake of both sugar and salt. And this says a lot. It tells us that what we eat absolutely determines our outcomes. So the advice that I would have for people is that, look, while you're younger, your body can tolerate a lot of things. As you get older, the food you eat could be your poison. So it's very important for us to manage what we eat. Both sugar and salt, they are probably the commonest additives we have all over the world, but they also could be the source of a lot of these chronic conditions we tend to.
Wow, eye-opener. That sugar thing with cancer, the link.
So important to open their ears. as he's saying now, I can count up to like 5 people in my circle that they must watch so that it don't look as if I'm the only one speaking.
Yeah, right. Okay, so that said, we've been talking about diet, so let's bring it home to exercises. How can exercise actually impact positively on the progression of chronic diseases? So I think for the so that we can understand it, the others can understand it better, we will take it systematically. From the central nervous system, from the brain, down to the cardiovascular system, the gastrointestinal system. So if you take it in that phase, it will be much easier for them to be able to relate with. So from the CNS, how? Okay. Exercising. So now we're zeroing on the benefits of exercising, as it now helps impacting positively in the progression of chronic disease. So
basically, I normally tell people in terms of the central nervous system, I tell people, just try this. Wake up in the morning, go for a walk, a 1-hour walk. When you get back home, how do you feel? Psychologically, you feel better.
Cool.
You feel optimistic, you feel good. So in terms of, the way it makes you feel, you can't compare it with anything else. You can be on sometimes antidepressants or anti-anxiety medications and things like that. Or maybe, say you're stressed, you have something bothering you, and you go for a 1-hour walk. When you come back home from that walk, how do you feel?
Because you have your hormones that release, or the cortisol release, the endorphins.
So it makes, exercising, number one, makes you feel good. Yeah. You can't take that away from you. Yeah. If you go into the cardiovascular system, when you exercise, you're using your muscles. Sure. There's a saying that when all the muscles are intact, the heart is working less.
Sure. Sure.
So it's a way of reducing the strain on your heart. When you look at athletes, you check their pulse rate. Sometimes you feel they have a problem, but they don't. Most athletes, footballers, professional athletes, if you check their pulse rate, it's normally lower than 60. Yeah. That is because their muscles are well built and they tend to be compensating for the need of the heart. So the heart doesn't have to work as hard as it will. Sure. So these are the effects of the heart, of exercise, in helping the heart compensate. The muscles, you have a well-built body. Sometimes, if you're not exercising, where you're supposed to have muscles, you have a lot of maybe fat bits around there. Remember, your heart is a pump. Yeah. So that pumping machine, it has to work harder to get the blood from that place. Yeah. But if you have rigid muscles there,
can't move,
clamping on the blood vessels, the pumping machine is not working as hard.
And you need to help it to work.
Yeah.
Yeah, right.
So I always try to be simplistic in my explanation so that people can
understand it better.
Understand what I'm trying to say. When it comes to the digestive system, I always tell people this. Exercise has to do with once you're exercising psychologically, you know the stress you're going through to exercise. That's the first part. You start thinking, I'm working this hard to burn this calorie. I need to be careful not to take it in again.
I agree. I don't know. Like the check and balance. Just act as a check and balance.
So you go to the gym, you work out for like maybe 1 hour.
Come back and download 2 wraps of food
and the truth is that I tell people, exercise is not a magic wand. Actually, you can't go to the gym. If you go to the gym, you spend 3 hours there, you probably would only burn like 500 calories.
You're right. And you come back tired and exhausted. Why do you want to stretch your 3 hours?
But remember, that 500 calories, it could be 1 loaf of bread.
Yes.
It's not the could be
bread and egg.
Bread and egg. With 2 slices of bread and 2
we've gained it
fried egg. That's 500 calories.
So
it's that thing there. In fact,
it's frustrating.
So when I advise people, I tell them, look, exercising is not a solution, it's a lifestyle.
Yeah.
If you want it to be your solution, it has to be incorporated into your life. And when I want people to lose weight also, I don't tell them exercise to lose weight. Because they don't see that impact
immediately. And that can be very frustrating.
Yes.
Because they want immediate results.
It needs a lot of discipline. It's not motivation. Because anybody can be motivated. It's discipline that will keep you going.
Keep it up. So for you to see the impact of exercise, it probably take like a year. But the immediate psychological impact, it is there.
So, yeah.
You feel good about yourself.
Yeah.
You feel
You're
healthy.
mentally alert.
Yeah. But then losing weight, sometimes even patients with arthritis or joint pain and things like that, the impact also is not immediate. In fact, the immediate impact could be much more painful because you have to work out through those joint pain and things. But by the time you start losing weight, by the time your muscles start getting rigid, you now start feeling less pain. You start noticing that you don't need to take those pain medications as much as you used to take them. So exercise has to be a lifestyle. It's not an immediate solution.
Yeah.
And I always tell people, if you want an immediate solution, it is not exercise. But if you want a long-lasting solution, where you will see the impact in 20 years' time, by the time you're 60, 70, 80, then you have to do it with exercise.
Even for the respiratory?
Yeah, of course. When you're exercising, you breathe in, you inspire, and then you're using your lungs very well. Especially, now there are different types of exercises.
Okay.
You have the low intensity exercise, walking down the street, some types of aerobics. You have the high intensity exercise, like sprinting 100 meters. You have the medium intensity exercise, those like weightlifting amongst other things. And then, of course, football, basketball, those are also high intensity exercises.
Swimming, where does that fall?
It's medium intensity exercise.
And that one takes very good care of almost all the systems.
Using all the muscles, you breathe in.
For asthmatic patients, it's very helpful for them.
Yeah.
Thank you so much, Dr. DOSUNMU. And I hope that when next we call you, you're going to come on board to shed more light on, this very basic information that we all need, because it starts from being basic. We don't need highfalutin things to stay healthy. Just by exercising, eating right, having the right people in your corner, you're already on that lifestyle, of keeping your holistic wellness. Once again, thank you very much.
Thank you. Sorry, I just want to say something.
Yes,
in terms of the diet,
yes, please.
I always advise people, if you have a chronic condition, try to work with a nutritionist as well.
Awesome.
It always helps. Sometimes they will tell...
What if they don't have the money? I'm speaking for them now.
Well, the doctor can only advise you in a very broad way.
Broad way, okay.
The nutritionist can help you draw a meal chart
right.
and all those things.
I'm a living witness. It's not about I know it here. It's about somebody who knows the tiny details and everything that encompasses for each food, each fruit, and then help to build that.
Even talking about not having the money, you mustn't really go to a very big hospital with the brand names to get the advice. We have government hospitals.
Yeah.
You have nutritionists
and
there.
They have departments that have nutrition.
Yeah.
For those that don't know, they should go to government hospitals. It's not all about the names.
So there are government hospitals that have nutritionists. It doesn't have to be private establishment or a privately owned nutritionist. Government and they are usually massive. They are not one small. They have several people in that
Great professionals.
On this note, remember this word that the expert said at the very beginning. Diet can be your food to survive or your poison. Which one are you picking from today? My name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Thank you very much, Dr. DOSUNMU, for coming on our program. It's actually, I'm very particularly excited because having you on board here actually gladdens my heart. And for taking out your time out of your very busy schedule. And I'm sure our audience actually benefited immensely from all that you have said. Thank you so much. And trust me now, Dr. Mamina, I will invite you again for come and share your experience, because if you have not been to the physicians on this program, you need to actually be on the physicians. And I'm happy you made it here. So our viewers, I just want to say thank you for keeping a date with us again on your favorite Health TV talk show, The Physicians, where your health is our business and will always be our business. And for the elderly that are watching, please remember your diet. Don't eat very late. If you must take something when it's far gone in the night, you can just take little fruits, plenty of water, and you sleep. Sleep early. Don't allow anything to disturb your mental health. My name remains Dr. Martina Agbere. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Dietary nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Dietary from LB Pharma. Dietary, love yourself.